This is one of our important efforts to highlight what you do, how you're engaged around the world. I just was looking at a lot of the posters, and I'm very enthused and excited by not just what you did, but how you talk about what you did, which is just wonderful. You've demonstrated with your posters so beautifully how Global Health at Duke embraces a diversity of topics and students. And you should know that there's no better way I could tell people what global health is about than through your posters. Before I say any more though, there are some winners of the photo contest here that I'd like to stand up and be recognized. There are three of you. Jocelyn Street, are you here? There you go. Your photo was from India. And Benjamin Ramsey, are you here? That's good, there's Benjamin. His photo was from Togo. And Carl Lawrence, there's Carl, his photo was from Uganda. Thank you, and I'm going to hang these photos in our Trent Hall so people will see them. I might even have them in my office, we'll see, to take some others out. So the Global Health Institute, I hope all of you know now, is one of the best examples of the university's focus on interdisciplinary education and research. And we're becoming more and more interested on what we call vertical integration. You're going to hear more about this idea of learners at different levels in their education working together and doing projects together, diverse teams of leaders with different backgrounds and experiences, even doing field projects together. This is something in our future, but I think what you've shown us outside nicely shows us how people working together can come up with really interesting ideas. The idea of bringing together undergraduates and master students, doctoral students, postdocs, if you think about that, it could really lead to some interesting mentoring and experiences and exchange of ideas. And some of you may have a chance to be part of that in the future. Now, we are constantly evaluating our academic programs and listening to you more than anyone else. And most of you know about our certificate, of course, and our Masters of Science, and our Global Health track for medical students. But right now, I think, if I believe what's in the Chronicle, the Arts and Science Curriculum Committee is considering a proposal for an undergraduate major in global health, which would be taken in the context of a double major. I don't know how many of you have heard that. We've submitted a proposal to the committee. We're waiting to hear. And a lot of that was driven by student undergraduate enthusiasm and a lot of complaints about too many program twos. And people feeling, if there are so many program twos, why isn't there a major? So I have to thank all of you in the room for stimulating that idea and helping us move forward with a proposal. And we're also submitting a proposal for a doctoral certificate in global health, which would be available to all doctoral students on the campus if they want to take it. It's being reviewed by the graduate school. So we keep thinking of new ideas, new ways to engage students, new ways for you to learn about global health, and new ways to become leaders in the field. Now, I want to tell you a little bit more about students. I was in Washington last week, some of you may know if it was a story in the Chronicle, to participate in the launch of a new $130 million initiative of the U.S. Agency for International Development. You all know what USAID is. It's the aid arm of our State Department. And this initiative is called the Higher Education Solutions Network. And it's intended to leverage the power of universities to create breakthroughs in major development challenges. It's a real change in the attitude of USAID after years of, I won't say ignoring, but not really working with universities. They've now decided that we can really be helpful to them and we can partner and we can help them solve some of their development challenges. There were 550 applications, if you can believe it. 7 were chosen, and 7 universities were chosen, and Duke was one of them. And the proposal that we put in was to establish the Social Entrepreneurship Accelerator at Duke, which is called SEAD, S-E-A-D, Social Entrepreneurship Accelerator at Duke. And what it will be is a global health and innovation lab that will identify and support the discovery, testing, and scaling of innovations in prevention and treatment of disease in low and middle income countries. And what I can tell you is this initiative represents more than a willingness, more like the vocation or the calling of Duke University to promote an agenda of entrepreneurship, innovation, and creative problems creative problem solving around global health. The program will be led by the Fuqua School of Business. They have a program on social entrepreneurship, and the School of Medicine. There's a program there on international health partnerships for healthcare, and our institute will provide the coordination with participation of the Pratt School of Engineering and the Sanford School of Public Policy. Now, why do I tell you all this? I tell you all this because you would have been very pleased if you had been sitting with me and in the meetings that I had with Rod Shah, who's the USAID administrator, Hillary Clinton, who you all know is the Secretary of State, and John Holdren, who you may not know, but he's President Obama's advisor for science and technology. We 7 universities met individually with them. And what was just a recurrent theme and what they told us was that one of the main reasons that AID had launched this initiative was to provide more opportunities for students to become involved in projects centered around innovation. So I well imagine our having even bigger showcases in the future. AID is probably going to open an office in Virginia that will house something like 250 students in the summer from these 7 universities to be able to think about and design and then go to the field and apply projects in innovation in the 80 USAID missions around the world. So that the reason why, as I say, I'm telling you this, it's great that Duke won, and that's a great thing for us, but I really wanted you to know how much this was driven by our State Department's awareness of all that students are doing in global health, particularly around innovation, and wanting to play a role in building the leaders of the future in global health and innovation. The other 6 universities are not working in health. They're working in agriculture, or in what's called development engineering, or in security, or in agriculture, or in climate change. Each university has a different lead. We're the lead in global health. So I wanted to let you know that you had a role to play in the thinking of our government. I just want to conclude by urging all of the students here today to not just learn from our faculty and from our staff, but also from each other and from the communities where you work. I could tell by looking at the posters and by talking with you that many of you are well aware of this. I promise you that from our standpoint in the Institute, we will continue to develop and improve our educational programs. We will continue to respond to your boundless enthusiasm and your desire to make a difference in the world and make the world a better place. And I'm happy we'll hear some presentations now, and keep pushing us to do more and to help you be what you want to be. Thank you.